Hello and welcome to the Arise interview, where we take time to reflect on the big stories from the news and on the fortunes and affairs of the world in an hour of conversation with commentators, analysts and thought leaders. I'm Charles Ihekweazu. Coming up in the next 60 minutes, until now, countries like Nigeria have been behind the coronavirus global curve, with the rate of COVID-19 infections and fatalities being very low compared to other parts of the world. But the latest figures and the appearance of a highly transmissible mutation suggest that the situation is changing for the worse, and Nigeria and other countries in Africa are bracing themselves as the pandemic races towards its peak. So how much more difficult does this make containment, and what sort of new dangers does it pose? We'll speak to the Director General of Nigeria's Center for Disease Control in a moment. And later, despite cases of coronavirus being on the rise across Nigeria, many people in the country still don't believe that the pandemic is real. Fake news and mistrust in the government mean a lot of Nigerians think the pandemic is a hoax. But hospitals in the country tell a different story. We'll speak to a professor of medicine and dean of the Faculty of Clinical Sciences at the University of Abuja, which is in charge of one of the leading COVID-19 treatment centers here in the federal capital. Coming up. Now, in the past couple of months, the number of cases of COVID-19 in Nigeria have risen dramatically, raising concerns that a second wave is now almost certainly upon the country. And it's posing new dangers and challenges for Nigeria's health workers as the new year advances and the pandemic hurtles towards its peak. Mutations in the virus are now said to be in the country, at least potentially, making the disease significantly more transmissible and raising the prospect that this second wave could be even more dispersed and dominant. According to Nigeria's Center for Disease Control, the country's fragile healthcare system stands at risk of being overburdened as the virus spreads into ever more areas. There are also grave concerns that the risk of transmission is increasing because many people in Nigeria seem to be adhering less to the rules, such as wearing masks and maintaining social distancing. So how much more difficult does this make containment, and what sort of new dangers does it pose? And what about all this stuff about new variants and whether or not the vaccines that have been developed can cope with these powerful mutations? Well, to answer those questions and many more, I'm joined now by the Chief Executive and Director General of Nigeria's Center for Disease Control, Dr. Chikwe Ihekweazu. Thank you very much indeed, Dr. Ihekweazu, for joining us. A busy time for you, no doubt, so we appreciate the time that you've given us. What's the national picture right now with regard to COVID infections and deaths, and which part of the country is leading the infection and mortality rate in Nigeria?
Thanks, Charles. Great to be on your show, and always good to be on Arise TV. You know, we've gotten to 130,000 cases in Nigeria, just over, and about 1,600 deaths just under. We've done just over 1.3 million cases in new suspected cases that has led us to those figures. We know we're not finding all the cases in Nigeria. Many states are still not testing as many as they should be, but right now, 80% of all the cases in Nigeria are in 4 states, Lagos, the FCT, Kaduna, and Plateau states. And Lagos has by far the highest burden of cases in Nigeria. This is really not surprising. You know, we all know that the infection first got into Nigeria in returning travelers to Lagos. Lagos is by far Nigeria's most populous city. Transmission of a virus is a factor of population density, and the virus itself and the environment. And all these factors play together to make Lagos really the ideal opportunity for transmission. Having said that, Lagos has also been at the fulcrum of the response and really mounted a very aggressive response for which they really deserve a lot of credit. But really, that's the situation in Nigeria. We're now well into the second wave, as you rightly mentioned at the beginning of your show. That says that, you know, we're now seeing close to 2,000 cases a day, sometimes 1,005, anything between that and 2,000, well above the daily average of the first peak of cases. So it means there is intense transmission happening in many states in Nigeria, and we have to continue the very aggressive implementation of public health measures that we've been carrying out across the country to mitigate the risks of transmission as much as possible.
Well, I mean, we'll talk in a moment about what you're actually doing to mitigate that transmission, but can we trust the data about the number of cases and fatalities that are COVID-related across Nigeria, or could it be a lot worse because there are possibly many cases of mild symptoms or asymptomatic carriers?
Oh, absolutely. You know, when you say, can we trust the data? We can absolutely trust the data in terms of its representation of what is going on. You know, what we need to do is get people to test more, to be more open to testing for physicians and healthcare workers, to be more encouraging of people to actually go for a test when they think they need one, and stop treating people for malaria over and over again, as we stated recently. So we can only report the data as it comes, right? What I can absolutely say for sure, we've got close to 120 labs now working across this country, public and private sector, that work 24/7, very hard to get the testing done, to get the results done, to get the figures announced every single night in Nigeria for the past year. Very few other data points, in fact, none other than I know, is reported every single day in the public sector in Nigeria. So we've been working very hard to report the facts as they are. We are confident of our data as representative of the trends of infection in Nigeria. But of course, we're definitely not finding all the cases, because if we're to find all the cases, it's a factor of several things way beyond what actually happens in the lab. People actually have to go to a facility, have to get their sample tested, and those tests have to then be reported. The second part of the chain happens fairly well now. The first part is what we're trying to encourage people to do a lot more of, because that's really the only way we can get ahead of this. We can't get ahead of it by, you know, pretending it doesn't exist, wishing it away when we have symptoms, and hoping that somehow it will go away. This is a virus. We keep encouraging people to do the best they can to prevent transmission with all the public health measures we've been encouraging. But if you think you may be infected, that maybe you've been in contact with someone that has been infected, or maybe you've been exposed to a scenario where transmission might have happened, or you have, you know, these fevers, slightly feeling uncomfortable, weak, you know, please do go for a test. We've worked very hard to make testing available, and now really is the responsibility of all of us to avail ourselves of the testing facilities across the country.
And Dr. Ihekweazu, on a global scale, a year on, the world still grappling with the coronavirus. Global cases now stand at more than 100 million. The number of deaths, more than 2 million. Those figures take some digesting, don't they? And countries, of course, also now battling with new virus variants and vaccine shortfalls. What's the situation as far as Nigeria and the new COVID variant are concerned?
Yeah, Charles, you know, when you see the numbers across the world, you know, sometimes when you see numbers as big as that, it's very easy to slip into this frame of mind of thinking about them as statistics, right? The numbers are, you know, really incredible. And within those numbers, you know, every week in Nigeria, because of the role I'm in, I actually meet a lot of individuals, infected people in hospitals, people that have lost loved ones. So it's always important for us to remember that behind these numbers are people. And we have managed not to really get into a bad situation, as might have been the case in many other countries. So I speak to colleagues around the world. Every country is struggling with this, and public health professionals have been extremely stretched. Charles, to the second part of your question on variants, let me try and explain it this way. You know, if you think about evolution and mankind, and the pictures of how the species that existed before humans evolved and how humans have evolved since then, what has happened is that with every cycle of birth, you know, people adapt to the environment, become fitter. The fittest survive, the weak die away, and that's how humanity has evolved to where we are today. The same thing happens with viruses, only that it happens a lot quicker. So because the lifespan for viruses is so short, sometimes in days, sometimes even in hours, you know, viruses evolve. As they evolve, they become fitter to survive in humans or whatever else they're circulating. And as they survive, they try and adapt and become fitter to survive. And really, that is what is happening. So when you talk about a new virus, what it means is that virus has circulated in that environment and has become fitter and acquired powers to survive better, to transmit better, to cause more disease. And really, that's what we're seeing happening in the new variants, as we call them, that now exist. So the news bit of it is not that there's new variants, because viruses by definition mutate all the time. The news is that these specific new variants have been shown to be associated with an increased capability to transmit, so to jump from one to the other. Now that has been demonstrated in the countries that are able to measure this systematically. What we've done is try and increase our capacity to do whole genome sequencing, which is the mechanism through which you detect new variants. Now, sequencing in itself, sorry I'm using these technical terms, but sequencing is the only way you can say this virus is different from the other, and therefore potentially a new variant. And we don't have extensive sequencing capabilities in Nigeria. We can do it in 3 centers. In Lagos, the Nigeria Institute for Medical Research, here at the Nigeria Center for Disease Control, and thirdly at the Africa Center for Excellence in Genomics. So between 3 of us, we're now scaling our capacity to do this, making sure that we're able to detect this, but recognizing that we're just not at the point where we can do this to scale. So we have to make the best of existing resources, and through that, we've identified a few cases of the new so-called UK variant, the B1.1.7, here in Nigeria over the last week or 2.
Well, thank you for setting that out very, very clearly and very articulately. And just to be absolutely ineluctably clear, you're saying that this more malignant variant has been found in Nigeria, and it is the UK version, and there isn't a new version that is absolutely and completely unique to Nigeria.
Yes, well, so Charles, it's important to understand this. There are many variants of this virus in Nigeria already, just like there are across the world. But the one specifically that is linked to an increase in transmission is the one I just described. And we've found 7 of them, but 7 out of only 300 that we've been able to sequence, right? Now, this variant has been also found in many countries in the world. And we all know that the UK is one of our primary travel destinations for historical reasons in Nigeria. So it was not surprising to any of us to have found that in Nigeria. What we're not able to do, which is done in the UK, is to say, listen, 70% of the viruses circulating in Nigeria are because of variant A or B. In order to do that, you really need to have sequencing capacity to scale. So we can't do that currently. We're building up our capabilities to do that. It will require a significant investment in certain areas to improve the skills, the equipment, the reagents that we have. So it's not something you can do overnight, but we're working towards that. But now that we know at least that this variant is in Nigeria, and potentially one of the reasons for the increased transmission that we have seen, the onus is on us now to really articulately communicate this to Nigerians. But listen, Charles, whether it's the old variant or the new variant, in terms of what we need to do as citizens, it's still the same thing. It's just that we need to do it a lot more aggressively. What triggered the world's interest on this variant was really in the UK at the later parts of last year, if you remember, as despite a very aggressive lockdown in London and in the southeast of England, that country continued to see an increase in cases. It was that, almost confusing situation that then triggered public health colleagues to then look a little bit further to see how come the measures that we used so effectively a few months ago to suppress transmission was no longer sufficient to suppress transmission now. So that was when questions were asked, and then colleagues there figured out, listen, this is a new variant, that's a lot fitter, it's a lot more able to be transmitted from one to the other. So, but ultimately, what people need to do, ourselves, yourself, everyone listening to this show, is the same. We've got to take more serious the public health measures that we've been talking about. This is a really difficult virus to deal with. We know that we're working towards having access to vaccines, but we can't wait till that point in order to do what we need to do today. So really, we have to do a lot more. Insist that people wear masks, not just sometimes, but all the time. Really avoid the temptation to go for social gatherings where you have a lot of people, especially in small rooms. Really form that habit of washing your hands all the time. But apart from saying all these things to ourselves, and we've said them to ourselves over and over again, it's how do we enforce that this happens in the small groups that we form, within our families, within our workspaces, wherever we find ourselves in. Do we have the courage to talk to that person at the beginning of the shop and say, listen, why are you serving me without a mask? Do we have the courage to stand up in church if you have to attend and say to the person next to me, why are you not wearing your mask? So how are we able to transform these things that seem unnatural into the most natural activities so that society begins to abhor a situation where people are not wearing masks, where people are clustered together? And that's really is our point to Nigerians today, that this is really a life or death situation. And just like the DG of WHO said over the weekend, we've got to treat every decision we make about meeting people as a life or death decision, and really decide, is this meeting necessary, absolutely necessary for me to go into? And if it's not, if I can do it through a phone call, through a Zoom call, through any other means, maybe it's the time, and now is the time to reconsider those decisions if we want to stay alive and keep our family alive. Because sometimes we might have a mild infection or an asymptomatic infection, but it's that person that we meet and transmit that virus to that ends up in intensive care units across the country.
And those are very important points that you've raised there, Dr. Ihekweazu, and I hope people are taking all that on board. One of the questions being asked as well is whether these new vaccines all work against this coronavirus variant or variants that you're talking about. I mean, that are emerging all the time, such as this variant that's in Nigeria that you've come across. I mean, what's the state of play with the vaccines?
Yeah, so Charles, you really hit on the head one of the sources of greatest anxiety in the scientific community, whether the evolution of these new variants will have an impact on the efficacy of the existing vaccines. Because by the time the vaccines, the development of the vaccine started, these variants did not exist, right? So right now, from all indications, the vaccines available are very effective against the B117 strain, and that's good news. Also, the other bit of good news is the technology to develop these vaccines has advanced so much that right now the vaccine developers are already tweaking the vaccines to make sure that they cover the new strains even as we've started using the vaccines available. But you see, apart from the specific efficacy of a vaccine against a strain, the other big factor here is achieving coverage of vaccination as quickly as possible. Because, you know, if we're able to, as a global community, develop these vaccines and enable equitable access across the world to these vaccines, then we dampen transmission. And if you limit transmission, this virus doesn't have that ability to evolve as quickly as it would otherwise have done. So this is really the biggest argument globally against what is happening currently, where specific countries are limiting access to vaccines to their own populations. The fact is that if you vaccinate your entire population and a more virulent strain, because they're now fitter, develops in another country and comes back to your country, then you're back to square one. So the only way we, when I say we as a global community can get out of this is when there's enough vaccine available for everyone that needs that vaccine. That way we dampen transmission and buy ourselves the time to get out of this. So our colleagues across the National Primary Healthcare Development Agency that lead on vaccine, logistics, distribution in Nigeria are working very hard to make sure we have access to these vaccines as quickly as possible. We have great news from COVAX, from the African Union, from some parts of corporate Nigeria, everyone working together, supporting the efforts of the federal government, led by the National Primary Healthcare Development Agency, to make sure that we have access to these vaccines as quickly as possible. But Charles, my final point on this particular issue is, you know, even when we do have access, you know, it will still take a while for us to get enough people vaccinated for us to then, you know, get back to life as usual. So we have to manage the expectations of Nigerians to realize these change in lifestyles that we've advocated is something we'll have to really live with for quite a number of months to come, in order for us to then, until we get out of the space by vaccinating sufficient people in Nigeria, but in also making sure every other country in the world also has access to vaccines.
And we've got about 60 seconds left or so. You made a point there saying if and when Nigeria starts using the vaccines. Clearly the country hasn't started inoculating its population. What's your estimate of when that inoculation program is likely to start?
Yeah, so my colleague, Dr. Faisal Shuaib, announced yesterday at the Presidential Task Force briefing that we're looking to get our first doses at the end of this month, latest early next month. One thing I can assure you of is that, you know, all hands are on deck. There's never been a time where our collective efforts have been aligned around a single focus on making sure Nigerians have access to these vaccines as quickly as possible. It hurts you, it hurts me, as it hurts everyone when we see pictures of people getting the vaccines across the world. We know that over 100 million people have received these vaccines so far, but this is not a problem unique to Nigeria. Many other African countries are in the same situation, Southeast Asia, so we're working very hard, and it's beyond what we can do ourselves. I think we need a completely different landscape to access to vaccines globally. And we're also advocating on the global front to make sure that the world realizes that we've got to change that.
Okay, Dr. Chikwe Ihekweazu, Chief Executive and Director General of Nigeria's Center for Disease Control, thank you very much indeed. And you're watching the Arise interview. Plenty more still ahead, including as many people in Nigeria continue to believe that the pandemic is a hoax, the hospitals tell a different story. We'll speak to a professor of medicine who's in the front line. Stay with us.